Good afternoon. Paloma Sparks with OBI. We're going to give it a couple minutes and we'll get started. All right. Thank everyone for joining us. I'm Paloma Sparks with Oregon Business and Industry. I'm on the Paid Family Leave Advisory Council and have been very involved with development of paid family leave. Want to thank the Paid Leave Oregon team for joining us today to talk about equivalent plans and paid family leave generally. Just a note, if you have questions, we will get to those at the end of the presentation. So please use the Q&A function so we can answer your questions then. This will be recorded, so we'll have it available on the OBI website. And I will now turn over to Karen Hummelbaugh with Paid Leave Oregon, and she can get started and introduce the rest of her team. Thanks.
Thanks, Paloma. I appreciate it. And thank you for having us again and hosting this session. As Paloma just mentioned, in addition to providing an overview of the program, as we have in previous sessions, we're going to focus in on equivalent plans today and give a little more detail. And then hopefully we'll have plenty of time for questions and answers at the end of our session. I wanted to introduce you to our team here. On this slide is our complete leadership and outreach team. But today I am joined by our outreach and engagement manager, Michelle Rowland Schwartz, Jonathan Reynoso, Caitlin Critton, Philip Hudspeth, and Layla Hatoum. And they are here so that we can hopefully get to a lot of your specific questions when we get to the end after the presentation as our subject matter experts. So before we start talking about paid leave specifically, we do like to talk about the values we hold at the Oregon Employment Department, and the values reflect how we operate and guide all of our actions and decisions. And one of our agency goals is explicitly about engaging with communities in order to build strong relationships. And so we're hopeful that these sessions and ones like them are continuing to build on that commitment as we receive feedback and input from all of you. Our mission here at Paid Leave Oregon and our vision are a little bit unique, but they are reflective of the important work of the new program that we are implementing. And this is to ensure that individuals, employers, and families of every kind have the time, support, resources, and peace of mind they need during life's most important moments. Paid leave strives to ensure that we build this program with universal and equitable access, and this includes consciously designing our program with consideration for a number of things, such as disability, income, race and ethnicity, culture, gender and gender identity, folks' employment status, education level or geographic location, their access to technology, and previous justice system involvement. And we recognize that individuals we serve may have experienced trauma, or they actually might be in crisis when they access the program. So we're committed to using trauma-informed approaches when we're engaging with the public. So what is paid leave? Here in Oregon, paid leave is for 12 weeks, with 2 additional weeks for some pregnancy-related medical conditions. And leave can be taken in 3 broad categories that you see here on the screen. Family leave is to care for a family member with a serious illness or injury, or to bond with a new child after birth, adoption, or foster care placement. Medical leave is for one's own personal serious health condition. And then safe leave is for survivors of sexual assault, domestic violence, harassment, or stalking. And paid leave was passed by the legislature here in Oregon in 2019. We're one of 12 other programs like this across the country. You can see here on the screen where we sort of fall into implementation. Some have come before us and some will come after. But this paid leave provides an important and vital safety net for working Oregonians who need to take time off for major life events. And the hope is that the program has the potential to impact some of the ongoing causes we have for generational poverty in our state. It will give low-wage workers more opportunities than many of the rest of us already have, so that they can take time off to bond with children, for survivors of sexual assault and domestic violence to address their own safety and healing, and for individuals to take care of the health needs for themselves or their loved ones. We're headed into the final months of implementation, and you see here just a timeline of some of the major deliverables, which we are still on track for. Equivalent plans, which we're going to be talking about today, we will begin to accept this September, so September of 2022. And then individuals and employers will begin collecting and withholding contributions in January of 2023. And then we will begin paying benefits to qualifying individuals and issuing small business assistance grants starting in September of 2023. So paid leave covers nearly all employers in Oregon. That includes nonprofits, S-corps, religious organizations, and all employees except employees of the federal and tribal governments are required to participate in the paid leave program. Tribal governments, self-employed business owners, and independent contractors may choose to participate by notifying the paid leave program and choosing to opt into coverage. Contributions are how we're going to create the state trust, and contributions are a percentage of wages paid by both the employee and the employer. It's how we're going to fund the program together. And the contribution rate for paid leave is going to be set annually, no later than November 15th, but we can never exceed 1% of gross employee wages. That's in statute. And the rate for 2023 is already set. We just thought it was good to be able to share this with people in advance. And so this year's rate for 2023 for our first year programming will be 1% of up to $132,900 in wages. Earnings over that $132,900 are not subject to contributions. And the 1% rate was set after 2 years of analysis and actuary data, a lot of discussions with our advisory committee members, of which Paloma sits on that committee. That committee is made up of members representing business, worker, and community voices. And there are a number of reasons why the rate was chosen, but it will be reevaluated, as I mentioned, every year. So employees are going to pay 60% of the rate, and large employers pay 40% of the contribution rate. If you're a small employer with fewer than 25 employees, you are not required to pay the employer portion of the contributions. So just to provide an example, if you earned $1,000 in wages this month, the employee would pay $6 and the large employer would pay $4. Employers may choose to pay the employee portion as a benefit to their employees, so that is an option. So in terms of large employers, there are different rules. For large and small, we only have 2 sizes of employers for paid leave. Either you're 25 or more employees or fewer than 25. And employee size is determined by payroll reports that are submitted by the employer, and the employee count will be determined each April. The employee count includes sort of more of a head count, so it's full-time, part-time, seasonal, and temporary employees, as well as out-of-state workers. So it's really the true business size. Employers determine their size by counting the number of employees, including both those inside and outside of Oregon. And only workers hired to replace employees taking paid leave are excluded from that count. If you're a small employer, which again, we define as less than 25 employees, there are some special stipulations. Employers with fewer than 25 employees are not required to contribute the 40% share. The employee always contributes the 60% portion of the contribution, regardless of the size of their employer. There are assistance grants available for small employers that agree to pay the employer portion of contributions. So they may be eligible for an assistance grant to help with the costs of hiring a replacement worker or other significant wage-related costs. These grants are available are a $3,000 grant to hire a replacement worker or a $1,000 grant for wage-related costs, such as overtime or training costs. And this can be for up to $30,000 per year in grants per employer. If you are somebody who is self-employed, an independent contractor, you are a little bit different. While you're not required to participate in the Paid Leave Oregon program, you can opt in. And for the purposes of Paid Leave Oregon, self-employed is defined by how you pay yourself. If you're an employee of your business and you receive a paycheck that you report on a W-2, then you're considered an employee covered by Paid Leave Oregon. However, if you receive profits from the business that you report as self-employed income on your taxes, then you're considered self-employed, which means you can choose to participate or opt into the Paid Leave program. And if you do choose to opt in, you need to pay the employee portion of the contribution, so that's 60%. And then you would receive benefits just like any other worker paying into the state trust. So let's talk a minute about job protection under paid leave. The employee job is protected if an individual has worked for their employer for more than 90 days. And this applies whether you're a large or small employer. And if the position no longer exists, the employer may choose to place the employee in a different position with similar duties with the same pay. Oftentimes we're asked, like, what does this actually look like in dollars and cents in terms of contributions and benefits? So this slide shows some examples. We'll make sure everybody gets a copy of this presentation in the chat. But you can see that, for an example, a minimum wage worker who earns about $540 a week would be contributing about $168 for the year, and their employer would be paying about $112 in those contributions. But if that individual qualified for paid leave benefits and had an eligible, benefit, they would be getting $540 that first week and for the subsequent weeks. Lower wage workers, so as you can see there and by the example, receive 100% wage reimbursement. And then as we go up the wage scale, you receive less than 100% for workers in the middle and high income jobs. And this is all based on the state average weekly wage. Currently, we have the estimates for 2023, are $1,224.82, as you see on here, and the minimum weekly benefit amount is $61.24, and the maximum weekly benefit amount is $1,469.78. And this will adjust annually in June, and so there will be one more adjustment that happens before we begin to pay benefits in 2023. So let's dig into equivalent plans a little bit. Some businesses, and I'm guessing folks on this call have this interest, can choose to purchase or create their own equivalent plan versus participating in the state trust as I've described it. And so individuals working for an equivalent plan employer are going to still receive the same level or higher of benefit required by Paid Leave Oregon. So that when an employee has a life event, the worker would apply for leave, including any eligibility documentation. They would let their employer know that they would need leave. And then after they're approved for leave and benefits, they would receive those weekly payments for the amount of time needed. And if the employee has been employed for more than 90 days, their job would still need to be protected while receiving those paid leave benefits. So what must an equivalent plan include? An equivalent plan must, again, be equal to or greater. So it needs to provide benefits that are equal to or greater than the benefits offered by the state plan. And this includes allowing for all three of those leave types: family, medical, and safe leave reasons. You have to provide the same amount of time off, which is that 12 weeks of paid leave per year, plus in those specific pregnancy-related medical conditions, an additional 2 weeks. You have to allow the employee to take paid leave one day at a time or consecutively. You can't require additional conditions or restrictions for employees that use paid leave. You have to cover all employees who have been continuously employed with the employer for at least 30 calendar days. And then finally, you need to ensure that employee contributions are not greater than what would have been charged if they were participating in the state plan. Okay, so employers can start submitting applications this September. So here in a really short time, about a month, 5 weeks. The application fee for a new equivalent plan is $250, and the review process will take us about at least 30 days. And there are 2 types of equivalent plans an employer can choose from. So the first is an employer administered equivalent plan. This is where you as an employer assume all financial risk associated with the benefits and the administration of the equivalent plan, whether that plan is administered by you as the employer or a third-party administrator. And then the second is a fully insured equivalent plan. And this is where the employer purchases an insurance policy from an insurance company, and the benefits related to the plan are administered through that insurance policy. For both types of plans, employers will have to reapply for approval of their plans annually for the first 3 years. They will have to apply, for the first 3 years. And after the first 3 years, employers will no longer have to reapply for approval, and their equivalent plans will remain in place until they're withdrawn or ended. Just a couple of additional slides before we get into questions. One is just about rulemaking. We like to make sure that you know how to have input into this process. Obviously, Paloma's been heavily involved in this process on folks' behalf, but if folks are interested in this individually, you can certainly go sign up for updates, visit our website. We are in the final batch of rules currently of about 100, a little over 100 rules, I think, total. We are getting public comment this month and next on these final rules. And so just want to encourage people, if you have any interest in this, to participate. And then I think this is just a how to reach us kind of a slide. And again, we'll make sure everybody has these, but we have just updated our website. It's much more user-friendly, and there's also a contact us function in there, so you can certainly use that. And we're just at paidleave.oregon.gov, so fairly easy to remember. Or you can email us or call us here. If you go to the website, it's fairly easy to figure out now how to sign up for our mailing list, which is where you'll get the most up-to-date and quick information. We're sending out bulletins monthly, and we can also arrange if you'd like us to come speak to you or have further conversation. Those things can happen through any of these means as well. So with that, I think I'll take a breath here, and I know Paloma will help us with the Q&A and moderating us through this.
Right. So if you have any questions, please do put them in the Q&A. Right now we've got 2 questions, and I will start going through those. So first says, I have 4 providers that are owners of the business. They all get W-2s. Did they have to participate in this as well? Knowing the cap of 132,900 is factored in.
Mm-hmm. If they're all getting W-2s, then yes, then that means that they would be in that pool of people who are covered and required to participate. And so the answer is yes. And yeah.
So in terms of counting employees, is it head count, not FTE?
Yeah, headcount's a little bit easier way to think about this. It is sort of all of your employees, regardless of what state they work in, regardless of sort of their status as temporary, seasonal, full-time, part-time. So it is more of a headcount, correct?
Okay. And then hoping somebody from the Paid Leave Oregon team can just drop in a link, but
Yes.
There's a question about where can we see the proposed rules?
I think, Paloma, we have only host and panelist access to the chat, but I think, Katie, if we send you the link and also the presentation, can you post it for the participants? That might be the easiest way.
Yes,
So
that's fine.
Oh, okay, perfect. So if someone can just drop that in, we will get that information to folks.
more information on how employees will document eligibility for paid leave?
We're still working on what that benefits rollout looks like and what exactly documentation will look like, but we do know that people will be uploading information depending on the kind of leave they have. But so it would look something like a doctor saying that you have a serious health condition or that you are adopting or fostering or birthing a child. So there will be documentation required. It will be uploaded by the individual into one of our new modernized portals. And so that's what that will look like. We will have a lot more information coming out in the next months about what that physically looks like and also what types of documentation are allowable.
Then if an employer is using a fully insured equivalent plan, will the plan administrators need to seek approval? If the plan is approved, will the employer simply need to indicate which plan they're using?
I might use my lifeline with Caitlin here, but Caitlin, just let me know if I answer anything incorrectly here. But our partners at the Department of Consumer and Business Services are the ones who will be listing who are those third-party insurers who are eligible to provide paid leave plans in our state. And so that's like kind of step one. And then, but you as the business will still have to upload your particular paid leave documentation into what we call Francis, but it's the new employer portal. And so you can't just say like, oh, I'm using the, Aflac plan over here. You're going to actually have to, I believe, Caitlin, correct me, upload that binder into the system. And then that's part of what we'll go through for the approval. Is that correct? Okay.
Perfect, yes.
Okay, thank you. Just want to make sure I'm not going astray on any of this. Thank you.
All right. Let's see. We outsource our payroll. Does the deduction for employees, for both employees and employers, happen automatically through payroll each time?
I think this question is a really good one. And so the short answer would be it should be yes, happening like that. But you will want to, we are doing a lot of outreach to payroll providers, making sure that everybody understands, also accountants, all of the folks who are in these professions that do these services for many of you. But I would just encourage you to check in with your payroll provider and make sure that they're aware of this. If they're not, we'd be happy to talk to them, make sure they understand it, but it will be part of their responsibility, just like any other sort of contributions, taxes, fees, anything that comes out in regular payroll.
Okay. Then what is the deadline for submitting the equivalent plan to the state?
I think there are 2 deadlines here, and I might just not even try it, Caitlin, and hand it to you, because there is a deadline for declaring to us that you're planning to submit an equivalent plan, and then there is an actual final deadline next spring in which you have to have all those details into our portal. And I'm not going to guess. Go ahead and say the 2 dates.
No, that's right. And I will even say that there's not actually a deadline, because if employers don't meet one of those dates, you can apply at any time. It's just if you never want to contribute to the state program, if you know ahead of time that you want to get that before we start contributions, get everything figured out, then what Karen described is completely accurate. And so that would be by November 30th of this year, you would need to declare that you are going to offer an equivalent plan, or get your equivalent plan in for approval by that date. And then if you do a declaration, you can have until the end of May, so May 31st, to get your actual full application in to us in order to make sure it gets approved and in place in time for benefits in September.
Thank you.
Yeah, I have gotten several questions about this. I think people are a little confused on how the timeline is going to work on that.
Did that help, Paloma, or do we have additional?
No, I think that's good. I think
kind of a good start. Okay.
Continue to put that out there.
And maybe this will help too, Paloma. We are planning to go live with our phones for equivalent plans in August, and this is We'll have a published number here in the next short bit, hopefully by the end of this week, but we'll be able to share that with people too. So then they can call us, talk to staff, answer any of their own specific detailed questions so that coming into September, we have a little bit more information for everybody.
Can the employee roll over unused time?
The short answer to that one is no. And so really this is about, you're eligible for that 12 plus the 2 weeks in any year, but a year in this program is defined the week that you start to collect your benefit. So the week you're eligible for your benefit. So if I want to take leave for adopting my child and I start my leave on September 15th, then I would have to take my 12 weeks before September 14th of the following year, for example. And then it would be restarting that clock after that year. And so you don't roll over anything you didn't use. So for example, if I don't use any of my paid leave benefit in 2023, it just drops off. It's just not fine to use, and then I need to use it in 2024 and I'm able to do that, but there's no rolling over.
Yes, this is unlike sick time. So it's not sort of like a bank that's accumulating, accruing leave. It's just this is what you're allotted every year that you could take if you filed a claim. Correct me if I said anything that doesn't sound right.
Nope, that's correct. And there will be many of us who don't ever access our paid leave for many years or ever, and there will be other folks who need to access it more than once. So it will just depend, yeah.
Okay, then we have a question. You have equivalent plan examples, for example, a short-term or long-term disability policy?
I honestly don't know the answer to this one, Lisa, but if someone on staff does, do we have examples, or will DCBS have examples of what qualifying equivalent plan would look like, or do we have examples? Other states are difficult because our program's got some different nuances to it, so we can't really say like, hey, go look at the equivalent plans in Washington. Do we know if we'll have examples, anyone?
Yeah, it's not quite examples. DCBS is going to roll out their product standards for insurance carriers that has all of the requirements kind of in one templated place for insurance carriers. And then we're working on also drafting a version of that for employers so that you could go to one place that's easily accessible, because right now the requirements are in statute and rule. And so making sure there's kind of one document that lays out those requirements. But it wouldn't quite be an example as much as kind of a long list of all the requirements for each category.
Thank you.
And then the only thing to add, sorry, because the short-term disability and long-term disability were mentioned in that question, if you currently use a short-term or long-term disability plan or policy, it's likely not going to meet the requirements because our leave is so broad with the reasons that you described, Karen, earlier. So it would have to be modified in order to meet the requirements.
Thank you.
Okay. And then do employers have to continue to provide health insurance leave, and does PTO continue to accrue?
I'm going to toss this one to Caitlin or Jonathan if I can. Health insurance and other kinds of leave, do they still need to be accruing and offered when folks are out on their paid time off through paid leave?
Yeah, the health insurance does need to continue. I was trying to look at the wording. I need to double check on the PTO because I don't want to give the wrong answer on that. But health insurance, yes, the coverage needs to continue.
Thanks. I was actually catching up on the PTO too. So if we don't get an answer during the session, if we're not able to get it kind of behind the scenes right now, we'll make sure that Paloma gets the answer so she can share it with folks.
Yeah, my understanding is that PTO would not accrue while they're out on leave, but you wouldn't lose any already accrued PTO.
Yeah, that sounds right to me as well. I just think we just want to double check. I think that's correct. And I think the kind of a question that usually goes alongside this one is, do you have to take your accrued PTO prior to taking paid leave? And no, you do not. You could take your paid leave, and then you'd still have your banked of any other PTO that was offered that would be potentially available to you.
And then we have a question. Once the benefit use is locked in, will there be a training like this for the rollout? We have employees worried about the cost of a doctor's visit to be able to use the benefit. I think this is more of a question of, are we going to be offering more of these training opportunities?
Yeah, we are really open to offering as many and as often of trainings that we need to in whatever kind of environment works. So if you think that would work for your individual business, that would work best because you have a lot of folks or whatever, we can do that. That outreach team is here to do that. We have folks across the state. And also we will be doing equivalent plan as our next sort of kind of open conversations we're having. Those will be in August and September. Right now, we're just having informational sessions. My guess is after we finish that, we'll look at what is the next topic we need to cover. And those are just open to the public. And they generally have a format like this where we would do a little bit of an overview and then mostly have questions and answers for folks. So we can set things like that up and appreciate the input and feedback and being able to provide those. And we can do those continue to do them through OBI or through other means, and also we'll do them just individually as well.
It's your favorite question. Have you gotten any additional information regarding how these deductions and contributions will be treated for tax purposes? Last meeting, you indicated that you were still working on this.
Yes. We are still working on it with our Department of Justice and Department of Revenue folks. My hope is we have something in the next couple of months. We're just encouraging our Department of Revenue to be a little more responsive than the IRS has been so that we can give good answers to folks. I know there are a number of tax questions that need to be answered for people to be able to properly make decisions.
And then is the person able to only take 1 or 2 weeks or all 12 weeks? Are the requirements posted of what will qualify for the person asking for leave?
Yeah, that's a great question. And you would be eligible to take the amount of leave that you're qualified for. So yes, it could be that you're 5 weeks so that you can have a surgery. It doesn't have to be necessarily for 12 weeks. It also could be that you have one or more than one qualifying condition in that same year that starts. You can take leave for as small as a 1-day increment, or you can take it like weekly, but you can't take like hour by hour for your increments. And I already forgot the other part there. It's okay. Who's like, what are the requirements for qualifications for taking the leave? We will have.
And are they posted?
Yes.
Somewhere?
Yeah, so we can post what's in statute, and I think we can probably pretty quickly find that, like just what are the basic eligibility requirements for the 3 types of leave. But we will get more specific with individuals about like what documentation is required for those kinds of things, et cetera. Those we don't have yet, but those are posted. If someone on staff can maybe find that definition link and we could put that in the chat. I will say with the updates to our website, these things are much easier to find currently than they used to be, and there is a search function. So some of those things you'll be able to fill around if you go to our paid leave site as well.
And we had a similar question last time. I'm just going to follow up on it a bit. Will the Paid Leave Oregon team be producing a sort of handout that employers could provide, or that employees could just look at that they could have?
We will be doing a number of things in terms of sort of takeaway collateral, but one of those things will actually be like a model notice. So similar to what you have for like OSHA and FMLA that you're putting up in the break room, et cetera. That's something that also we will be getting out to employers early in the fall, so that you have all that information to share. It'll obviously be available electronically as well, so you can include it in payroll or paychecks, whatever that looks like for you. And then we have been working with a contractor on other sort of just leave behinds and takeaways, both for employers and also for individuals, so they kind of understand the program and they understand how to utilize it and what the deadlines are.
Great. Then this next one is sort of a multi-part, so I'm going to take it in parts about sort of asking just about definitions and what exactly they mean. So for medical leave, you know, it's defined as to care for yourself when you have a serious illness or injury. Question is, how is serious defined?
Yeah, there is an actual definition in statute that kind of defines what this means, and there are specifics to it. So I think that's something we could actually probably drop in the chat as well if we can get a hold of it. It does not mean you have strep throat this week. It does not mean you're out for the flu. In fact, many people in COVID probably wouldn't have qualified for paid leave unless they were like hospitalized or in the ICU, and that would be what sort of turns it into a serious health condition. This is not something where you're using it for like day-to-day regular kinds of illness. This is actually serious illness, like you're thinking, you know, cancer, hospitalization, surgery, those kinds of things.
And then related to the definition of family leave, does this cover parents whose childcare is interrupted? In other words, if the childcare provider calls in sick, childcare issues, etc.
I'm going to say the answer to that is a no, but anybody who disagrees with me should say, okay, that's no. I'm just going to leave it at that. It covers all those sort of your own personal things, but it doesn't anything peripheral like your childcare, school, those kinds of things. No, it would not cover.
It would be a serious health condition in the same way that it was described for your own. It would need to be that serious of a condition for the care as well.
And then final question, given that we now have paid leave Oregon, will Oregon still require employers to cover 1 week of paid sick time?
Yeah, so my understanding, again, if anybody needs to correct me if I misspeak, but all of the provisions that happen with paid sick time in Oregon, OFLA, FMLA are still in place. Those are separate and distinct programs and statutes from paid leave in Oregon. There may be a point in time where some combination of these things occurs, but currently they all do still exist in statute and are sort of like separately and individually siloed.
So I did attempt to provide the link to the rulemaking both in the Q&A, and I believe
Okay.
the Paid Leave Oregon team provided that in the chat. Oh, here's another question. Can an employee use their paid sick leave and PFMLI concurrently?
I honestly do not know the answer to that. If someone on staff, Jonathan or Caitlin, does, that's great if you can answer. Otherwise, we may have to get back to folks on this one. I know we're working on a matrix. Actually, Paloma helped with some corrections on it, and we've just sent it back to partners, and we're about ready to release it, but where we are sort of talking about the differences and similarities in both eligibility and what's protected, what's paid, what's not, what you can take concurrently or not with all the different leave types, but I don't know off the top of my head.
We do allow supplemental benefits. So if someone was going to use their paid sick leave or leave that they have accrued at their job, or even like a short-term disability policy at the same time, supplemental benefits are allowed. The statute requires or says that it's up to the average weekly wage of that individual. And so we are still working on how does that work with what information we give to employers about each individual's claim, and do they have enough? Will an employer have enough to limit or know the exact amount to meet up to, and how you guys pay out benefits? It gets tricky with how you may offer leave at your employment or your business. And so we're working on more information to come for that.
So, since we still have time and I'm not seeing any other questions, will you have sort of information from maybe the Bureau of Labor and Industries on the new Paid Leave Oregon website about sort of some of their interpretation about all of these things?
Mhm. Yes, that's something we are working with them on so that hopefully actually, whether you land on the BOLI site or you land on our site or some other site, that you're getting the same level of information. We're also working to actually help cross-train some of the people who answer the phones at different agencies to make sure that we're covering things that way as well. I do not think that information is on this current upgrade of the website, but that's just because we haven't agreed to the exact things yet. But so that would be something that happens in the next couple of months. That would be an update to the website's information.
Here we go. Oh, another question. If an employee qualifies and is out 12 weeks and then taps into the OFLA for another 12 weeks, potentially an employer could have an employee out for 6 months. Seems like such a hardship since most of us are already dealing with staffing shortages.
Yeah, I think there's like some question about like how much consecutive leave a person could take. Obviously, this leave is paid. Most people don't have a PTO package that would let them take paid leave beyond, for an entire another 3 months, although some people may. And so it then becomes a situation where how many employees would really be able to take consecutive leave. Some might be able to, that's unpaid, but that's certainly something that we all do need to consider. And I hear you on the labor market being tight, especially for skilled workers. I think this is another one where we're trying to work on that matrix so people can see about consecutive versus concurrent nature and qualifications.
Just a note for our members. OBI has been flagging this issue in a way that probably is annoying sometimes, that we're relentless about it. And we are certainly looking at all options for how to create some sort of consistency around the fact that we have so many leave laws out there that could create a lot of confusion for both employers and employees, but also that potential scenario of an employee being out, so much of the year. There's no easy way to do this, but we are, this has been a conversation we've been having probably at least for the last year or so. I'm gonna do a call for any more questions. And certainly, if you have questions and they weren't answered, feel free to reach out directly to OBI and we will get those to the Paid Leave Oregon team. So we did get another question. So the employee can take paid leave and not be required to exhaust their OFLA if they qualify?
This question gets a little complicated, and I might not always say this correctly, but sometimes OFLA will run concurrently, but there are things in OFLA that aren't covered by paid leave. So for example, bereavement and military leave. And so sometimes there are different conditions that might be taken into account. I don't know, Caitlin or Jonathan or someone else wants to add to that answer.
I lost Jonathan on my screen.
But I did see a message from him. I think he lost connectivity, so I apologize.
Oh, okay.
I just saw that.
I was gonna let him go, but I think what you said was accurate. The only thing I will say is that we're continuing to work on this. Kind of as Paloma described, we
Mhm.
know that this needs more work. And so there are questions out there of how do we make this work for everyone involved. But yes, when possible, if the qualifying leaves are, if it can run concurrently, that is what it would need to do. And that is what employers would apply the OFLA leave when possible, so that know that you can't choose to not exhaust your OFLA leave. The employee couldn't choose to exhaust it if it was. But I believe that the dates of employment of when one can be eligible for OFLA also doesn't align with when someone could take paid leave. And so there's the date question at play as well. And so figuring out some of those complicated factors is still to be done.
Yes. All right. Well, since I don't see any more questions, I think I will wrap it up and thank Paid Leave Oregon team. And once again, just a reminder, feel free to send additional questions to OBI or to join into the listening sessions that Paid Leave Oregon is hosting. I think that will be another opportunity to ask some more questions, make sure that they're tracking those things that people are unsure about.
Absolutely. Thanks, Paloma.
Thank you. Have a great day, everybody.